All right, guys, and welcome back. We're going to call this next section in our personal safety module. We're going to call this our self care section. It's going to cover a few different topics. It's going to seem like it's kind of jumbled, but I think we can kind of group it in a self care description. And we're going to start off by talking about personal hygiene and sanitation. This ties back earlier whenever we were talking about equipment, and I made mention of something to consider bringing in your pack as a trawl, and that's for digging cat holes or utilizing cat holes. So if you're out there in the bush, and inevitably it's going to happen, and you need to take care of some business, the proper way to do that is by utilizing a cat hole, and that's a small hole in the ground, roughly 6 to 8 inches deep, at least 200 feet away from water, trails, and camps. Okay, you want to have that pretty far away. For some perspective, a football field end zone to end zone is 300 feet. So 2/3 of that is how far away you need to be from a water trail or a camp, and you need to go at least 6 inches deep. Deeper you go is fine, but at least 6 inches deep. The key here is the only thing that goes in the hole is waste, and that is it. If you use any wet wipes, take make sure you have a little bag with you to take that with you, so that way you can remove any trash. That's not something we want to leave behind. And then to round that out, use a waterless soap or some hand sanitizer to remove any germs from needing to go in the bush. So the next topic we're going to discuss is dehydration, and I talked a lot in the equipment section about the need to figure out how you're going to carry your water. Dehydration has a profound impact on many bodily systems, and so it's very important for us to stay hydrated because it doesn't take much in form of dehydration to start affecting some of those body systems. A 2% loss in body fluids can result in thirst. If you're starting to feel thirsty, you're at least 2% dehydrated. If you're 5% dehydrated, all of a sudden you are more irritable. You may start to experience nausea or weakness. So it doesn't take long to go from being thirsty to actually start having an impact on your mentality and your ability to cope with your surroundings. Irritability, nausea, weakness that comes very quickly at a 5% loss in fluids. 10% can result in dizziness, headache, inability to walk. You'll have, or maybe even a tingling sensation in your limbs. At a 10% loss, it really starts to have a profound impact. The inability to walk, all of a sudden you have become a true liability in the field, and we need to figure out a way to extract you safely at that point. 15% dim vision, painful urination if you're urinating at all at that point, a swollen tongue, deafness, and numbness. As you can see, at 15%, we have some serious problems with our bodily systems, and a loss of greater than 15% can be fatal. And considering at 2%, we were just thirsty, so there's not much of a gap there between 2% and 15%, to where we are potentially looking at a fatal situation. Some very common symptoms that you see, obviously thirst and the dark urine are the most two commonly identified dehydration symptoms, followed by low urine output. Dark sunken eyes is another one. And I would always ask my daughter if she had been drinking her water, because that was one of the first symptoms that I would see, is she would have some really dark bags underneath her eyes and they would look sunken. And you could tell she was dehydrated just by looking at her eyes. Fatigue is another fairly common one you may feel. This is another one where you may be sitting around, you haven't done much, but you're sitting there going, why do I feel so tired? Well, start thinking about how much water did you push during the day, and that could be contributing to your fatigue. Emotional instability, loss of skin elasticity. That's where if you do the pinch test and grab a little skin on top, and if you pull it up and it doesn't snap back into place pretty quick, it's a sign of dehydration. Delayed capillary refill in your fingernail beds. If you put a little pinch there on your fingernail bed, it'll turn white. And how long it takes, if it takes longer than a second or two for that to refill, then that's potentially dehydrated at that point. And then the trench line down the center of your tongue is another symptom. Obviously, the greatest way to prevent this is to push your water. Push it before you go on a search, push it during a search, and push it after. It's the key there is to push water. I made mention of this earlier. I believe it was in the mental health and physical and mental health section, but one of the things I do every day whenever I get up is before I allow myself to have my coffee, I need to drink a quart of water, and so that way I start the day off with a strong hydration. I've got a quart of water in me that sets me up for a good day of staying hydrated. Be careful about consuming too much. Water poisoning is a very much a real thing, and it can be fatal. It results in swelling of the brain. It can really impact you just as negatively, if not more negatively, as being dehydrated. You want to drink enough where you're not thirsty and you're urinating regularly. So about every half hour, 45 minutes or so. That's about how frequently you should need to go, which causes problems for me at work whenever I have meetings that are about an hour long. By the time we're done with those, I am ready to go. So make sure you're pushing that water early and often. Next, we'll talk about some heat related illnesses, and we'll talk through hypothermia, and then we'll talk about hyperthermia. Search operators are frequently subjected to arduous work in adverse weather conditions, including extreme hot, extreme heat, or cold. Understanding the symptoms and preventative measures to combat common self care problems is crucial for a search operator. Prolonged exposure in cold environments can lead to hypothermia if not adequately protected. Hypothermia occurs whenever your body's core temperature drops below 97 degrees Fahrenheit, and the cases can range from mild to critical. Whenever we talk about mild cases of hypothermia, we're looking at a core body temperature of 97 to 93 degrees. What you're looking for in somebody is they may be alert, but they are vigorously shivering, and they may experience some clumsiness. They may fumble around a little bit, maybe even stutter their speech a little bit. You can tell that they are very cold. If you encounter if you yourself feel these symptoms, or you encounter another searcher or a victim exhibiting these symptoms, remove from exposure. That's the first thing we want to do in any heat-related illness or condition. Is if it's safe to remove from exposure, get them out of the adverse environments. That's what we want to do. We want to get them out if we can. If we have an ability to apply a mild heat source or promote some body movement, we want to do so. If we have an extra blanket, extra jacket, throw another layer on them, wrap them up. We want to reheat them gently and carefully, and we want them up moving around. If we can have them up moving around, the body will start to generate heat on its own, which is good. That'll raise that core body temperature. And then, of course, drinking warm liquids is another thing we can do to start bringing that body temperature up. Whenever we talk about moderate cases of hypothermia, this is whenever the body's core temperature is between 93 and 90 degrees. What we'll see a reduced level of consciousness. We start to see someone be very, very drowsy, slipping in and out of consciousness. They will have a lot of difficulty speaking, the stuttering, the being able to string together a line of thought is much more difficult. If that were the case, I would think my wife would think that I'm moderately hypothermic quite often because I can't string words together to save my life. But that's another symptom there. Profound forgetfulness. Again, my wife would think that I have hypothermia all the time. But just profound forgetfulness, not understanding kind of what the situation is, kind of losing a little bit of touch of reality, and then showing signs of depression. We're starting to experience some deep thoughts of dread at that point, where it's mentally you can tell that they are not in a good place. How we treat that is we treat that similarly to how we treat someone with mild hypothermia. We want to remove from exposure. If we can apply some heat to start to get them warmed up, we want to go ahead and do so. Again, you always want to be careful in doing that gradually. A difference here is instead of drinking warm liquids, we only want to offer warm sips of liquid if they're fully conscious. If they're going in and out, we may want to take a step back on that. But if they're fully conscious, then we'll offer only sips of warm water, of warm liquids. The big thing here is we really need to seek medical attention. In mild cases, if it's on the low end of mild, we may go get them checked out just for the sake of getting them checked out, peace of mind. Moderate, we certainly want to seek medical attention. Severe hypothermia is whenever the body's core temperature is between 90 degrees and 82 degrees. Here we start to there's the victim or the person may be unconscious fully. The shivering has stopped. They're no longer generating the heat on their own. They may even go as far as appear dead. At this point, they're slipping into unconsciousness. That means there's a greater potential for cardiac arrest. If it's safe to do so, we want to remove from exposure again. But this is again we need to start considering what are the impacts if we move them. Can we treat them here until better medical help arrives? Can we do what we need to do here, or is there a safe avenue for us to extract? If there's potential for extraction, we need to come up with that plan. We need to come up with that plan, start clearing away, getting the tools we need to extract, getting the resources there, develop and execute that extraction plan, and apply mild heat to keep the temperature from dropping further. So again, try your best to add more layers, and promote if there's a way to get them to generate a little bit of heat, that'd be great. But we want to apply that mild heat to keep the temperature from dropping further. We want to try to stabilize the best we can. And whenever we get into a critical case below 82 degrees, we're looking at no detectable signs of life. Assume the patient is revivable, even though you may not be detecting vital signs. They may still be there, so don't necessarily give up. Keep the airway open. Start doing CPR. Do your best to stabilize the temperature and extract immediately. At that point, we have to get them out of there. Best ways to prevent against hypothermia, of course, is understanding the weather, what the current weather is, what the predicted weather is, and making sure that we're dressing appropriately. We talked about this in clothing. Dress in layers. It could be the hypothermia could be as a result of the external temperature and the cold from that, or if you don't layer up properly and you're out there moving around, you could be sweating underneath of that, and then whenever you stop and cool off, that chill effect will start, and that could lead towards hypothermia, even if you have some clothing on over top of it. If you're not venting appropriately as you're going along, and you have that buildup of sweat underneath, then you could end up in a hypothermic state. Maintain proper nutrition and hydration. Make sure you're drinking your water, you're eating your food. Doing both of those will keep those body systems going. It'll generate some heat from within to process the food and water. So maintain that and eat and drink while you're out there in the field. Avoid alcohol, caffeine, and downer type medications. Anything that's going to thin your blood out, like aspirin or so. Try to avoid those type of products. Mentioned this earlier. Avoid overheating. Make sure you're opening up your jackets and those layers for ventilation. Keep yourself cool. You don't want to get in a position where you sweat. And the big thing here is do not discard clothing. Whenever for those that are hypothermic, if they will eventually hit a point where their nerve endings will start firing, and whenever this happens, they will feel like that they are on fire. They will feel like that they are burning. So they'll start just shedding clothing. If you do not discard clothing, even if you start to feel like you're like burning up, keep it on, keep it opened up, keep it opened up where you can vent a little bit. Don't discard it. If you don't think you're going to need it on your search, don't leave it in the truck. Pack it with you, put it in your bag. You may need it later on down the road. Okay. Hyperthermia is the other end of the spectrum in terms of heat-borne illnesses, and that's where you have an abnormally high body temperature. Anything that exceeds about 99 degrees or higher. People's core body temperatures can vary. Everyone's baseline is a little bit different. So we say that hyperthermia is typically whenever it's 99 or above. If you run a little hot to begin with, then it may be a little bit higher. But instead of looking at it at different stages in body temperature, what we're looking for are the symptoms. The symptoms in hyperthermia demonstrate what level of hyperthermia we are at. Heat cramps is usually where we start off, and that's where you start to see muscle cramps or spasms. Things start to lock up. I will get heat cramps. That's usually my indicator that I'm starting to really overheat. Is I will get really bad heat cramps. I get them in my thighs. My thighs are the first things to go. They will start to lock up, and no matter what kind of water I put away or what kind of rest I have, it's very hard for me to get rid of whenever I start to get to this point. It takes a few hours in some really hot environment to get there, and sometimes it's a lack of pushing water. Sometimes just a level of humidity in the area may just drain you physically and cause you to cramp up. But usually the heat cramps will come first. You want to try to stretch that out the best you can and get back at it. Take a minute to rest. Treat by eliminating exposure. If there's a chance for you to get to a cool place, get yourself to a cool place. Replenish your liquids and electrolytes. Get a little rest if you can. It's better treated outside of the search environment, but you're still able to function at this level with the heat cramps. It's your body's way of warning you that, hey, this is something you need to start paying attention to, because the next level we start to have some pretty serious impacts, and that's heat exhaustion. And I'm sure many of us have been there before. I've been there with some of these symptoms. I've never gone all the way to full-fledged heat stroke, but heat exhaustion just absolutely zaps you. It absolutely takes you out of your game. You may experience, blurred vision, dizziness. You may some really fast breathing. It's like really shallow. It's almost like you never really catch your breath. Your heart rate elevates. It elevates to the point where you feel like you really can't do anything to bring it down. You may stop for a rest for a second, and it just kind of keeps thumping away. Even whenever it drops down just a little bit, you stand up and all of a sudden it jumps back up again. At that point, you've hit heat exhaustion, fatigue, headache, nausea, and vomiting, general weakness overall. For me, whenever I've had heat exhaustion, I just feel absolutely wiped, and there's nothing I can do, and it takes me out for a couple days. It takes me out for a couple days. So really watch your exertion, the level of exertion you have, your water intake, especially whenever we start getting in hot temperatures with high humidity. It's really easy to get to this level, and it can put you out of commission for a short period of time if you're not careful. Treat very similarly to heat cramps. Remove from exposure. Put some liquids away. Get some rest. Again, it takes a little bit longer to recover whenever you hit this stage. But if you start seeing some severe symptoms, we need to consider extraction. At that point, it may be too much to ask for you to get back to base on your own. We may need to send a cart out, try to meet you somewhere to get you picked up and taken back. But that's certainly a level that whenever you hit, you do not want to continue hanging around out in the field for that. We want to go ahead and start extracting. Whenever we get to heat stroke, this is where things get very, very serious. You may observe a very strong pulse. It's very strong, and it does not seem to subside. The skin may be dry and it no longer sweats. You may see that, or you can see it in a couple flavors. You can see it either hot and flush or very pale. I've seen it both ways there. If it's severe enough, we may start seeing seizures and loss of consciousness. I personally have never had heat stroke. I have seen a couple people with it. It's pretty scary. It's pretty severe. This is something we remove from exposure immediately, and extract immediately. This is another one of those areas, just like with hypothermia, you don't want to try to lower the body's core temperature too aggressively. If someone is at either extreme, you want that gradual migration back towards normal core body temperature. In the case of hyperthermia, you don't want to pack them down with ice. You don't want to throw them in the freezer or anything like that to have them cool down. If the imbalance becomes too strong, it can put them into cardiac arrest, and then we have another problem on our. It's all about removing exposure and gradually adjusting that temperature down to something that they can manage. For all three of these, the best way again to mitigate the risk associated with this is dress appropriately for the weather, both current and predicted. Make sure you understand what it is now, what it's going to be later, what are the tools that you're going to need to make sure you get through that safely, and make sure you're dressing appropriately and bring the right tools. Maintain that nutrition and hydration. Push water. We got to push water constantly to help maintain those body systems. Listen to your body whenever your body's kind of hitting that spot where it feels like you're going a little too much. It's time to take a step back and rest, because you don't want to get on the far end of this scale. And then whenever you take a rest, do it in cool shaded areas. Give yourself a chance to kind of cool off there. Those cooling towels help as well. I typically keep one of those in my pack during the warmer months. Just dunk it in some water, pour some water on top of it, and drape it around your neck. It does a pretty good job keeping you cool, but make sure that you're dressing appropriately is a good thing too. All right, moving over to blister prevention and treatment. I'm the type of person too. I don't have it as bad as I used to, but I used to have terrible blisters, and there's a few reasons why. It could be from having ill proper fitting footwear. Easy for me to say. It could be not having a shoe that's too big or too small. Not filling it out with the right socks, or your socks aren't clean, or there's not enough cushion on your socks. There could be a few reasons why you generate a blister, but for whatever reason, there's excessive movement in your inside your shoe. There's either excessive movement, there's excessive moisture that's causing the irritation. So you want to always be mindful of the footwear you have and the condition of your socks. And if you're someone that has a problem with blisters, I'll still have them every now and then. They're not as bad as they used to be, though. They used to be pretty bad. You want to protect those problem areas the best you can. You want to put a little extra padding in there, proactively, maybe even put some moleskin on in some areas where you typically get some blisters. Moleskin is what we have in the picture here, and it's also a method of treatment. Whenever we have the small blisters, the best thing that you can do is kind of let them be. Don't rupture or drain them if it's a small blister and it's intact. What you want to do is you want to apply moleskin, and that's what this donut shaped object around the blister is. Usually, whenever you buy moleskin, it comes in a rectangle shape. And you take some scissors or you take a knife and you cut out this donut shape. What you want to have is the blister. Hang on. You want to have the blister inside of the moleskin, and you're using the moleskin to kind of push the shoe out, or provide a little cushioning between your foot and the side of your shoe there. So that's how you use the moleskin. That's usually the best thing to do. Moleskin is fantastic. You can also use blister or burn dressing. You can also use that as well. I prefer the moleskin. I keep some in my pack. I recommend you do too, especially if you are the type of person that blisters fairly easily or fairly regularly. This is a good tool to have in your pack, along with a small pair of scissors or a good knife that can cut through, that you can really get a good donut shape out of your moleskin. And you want to go completely around like they have in the picture here. You can see that the blister is like entirely inside of the moleskin. That's what we want to have there. If it's a larger blister like this one, I would consider a large blister on this individual. If it's larger and it's still intact, it may be time to go ahead and puncture it. You can do that with a needle or a safety pin. Just do it carefully, do it as sanitarily as possible. And after you puncture it and let it drain, what you need to do is, you need to trim that loose skin away, and then clean it and dress it. Make sure you have some stuff in your first aid kit to clean and dress, so that way you can make sure you keep that nice and sanitary, and keep it from getting infected. Okay. Next, we will talk about sunburn prevention and treatment. I'm also another person that I have walked away from many things with my fair share of sunburns. I can remember after my engagement down in Florida. I spent a solid week in Florida down there in the sun and without any sun protection or anything, and I walked out of there with a sunburn very similar to this one, including where my ears were blistering up and oozing on the car ride home. It was quite pleasant. Luckily for me, my new fiance still loved me regardless, and I was able to suffer on the car ride home. But the best way again to prevent is wearing appropriate PPE. That's the best way you can do. Apply sunscreen, wear a nice wide brim hat, something that casts some shade all the way around your head and neck area. They even have the fishing hoodies. I know Columbia makes some. They have the fishing hoodies, the lightweight hoodies that provide a little SPF protection. You can throw a hood over your head, protect the back of your neck and your ears. That's a good option as well for search and rescue work. If you can avoid working directly in the sun, when the sun's rays are the strongest, that's preferable as well. We're not always going to have that luxury in the line of work we're doing. Sometimes we got to go to work. But the best thing to do again is wear your PPE and apply your sunscreen. If you do walk away with a nasty little sunburn like our picture here, what you can do to treat it is you can apply a damp cloth to the affected area or take a cool shower. Either one. The big thing there is keeping it cool and keeping it somewhat moisturized there. Air dry it. Apply a moisturizer containing aloe vera or soy, and the aloe vera will do a really good job soothing that pain, and it makes that go a little bit, heal a little less painfully. If you are experiencing pain, you can take a pain reliever, popular a Tylenol, and to reduce some of that pain. Sometimes with the sunburn, though, you just kind of got to tough it out a little bit. Apply the aloe, apply the damp cloth. It'll take a few days to get it where the pain is pretty manageable. I mean, it's manageable, but where it really doesn't bother you that bad. May take a couple days depending on how severe your sunburn is. But that's how we're going to treat the sunburn there. And lastly, here I want to talk about airborne and bloodborne pathogens. This is an area where you could have a whole class devoted to both of these, and there are plenty of really good bloodborne pathogen trainings out there available to you. What you're going to get here is just kind of the high level scrub over on these two areas. Whenever we talk about airborne pathogens, these are diseases that can be transmitted by droplets or airborne routes, such as the flu, a rhinovirus, which is your seasonal cold, or a coronavirus, similar to what COVID-19 was. These are what we consider our airborne pathogens. So if you start seeing individuals or coming into contact with individuals with cold or flu-like symptoms, it's best to go ahead and avoid them, because airborne pathogens are transmitted by talking, coughing, or sneezing. It's about getting the droplets out. That's how they're spread around. Wearing appropriate PPE is probably the second best way to mitigate. Avoiding would be the first. If you still carry around or have access to an N95 mask, that's still a good thing to pop on. It's on 100%, but it does a pretty good job. But you want to make sure if you do wear a mask, it's something that has a good chance of stopping that transmission. The cloth masks, they really did not do much during COVID, and plenty of studies have shown that. The N95 was most effective, but it still wasn't 100%. But if you have access to one and that's of a serious concern to you, throw that on. Gloves, face shields, those are good things to wear as well as appropriate PPE. If you do come into contact, make sure you wash your hands thoroughly for at least 20 seconds using soap and warm water if you have that available to you. You can also hit it with some hand sanitizer if you don't have access to wash your hands thoroughly with soap and water. Hand sanitizer is one of those things where you can keep a little travel size thing in your pack. Very easy, convenient to get to. Pop a little on, and it's pretty well equally as good as washing your hands. So that's how we can protect against airborne pathogens. For bloodborne pathogens, these are pathogens that can produce viruses that can be present in human blood. So hepatitis B and C are good examples, along with HIV. They are transmitted by open sores, such as scrapes, cuts, damaged or broken skin, or blisters, mucous membranes, eyes, nose, and mouth, contaminated needles. That's another way that bloodborne pathogens can be transmitted, or through sexual contact. So again, with very similar to airborne pathogens, wearing appropriate PPE is the best way to prevent it against that. If you see someone that you need to administer some first aid to, and they're bleeding or they're excreting bodily fluids, make sure that you have appropriate PPE available to you: face masks, safety goggles, gloves, or face shields. Those are things that you should have handy to you and ready to use if you are going to be providing care to someone in this type of environment, who may be exhibiting some of those symptoms. After you do so, again, wash your hands thoroughly for at least 20 seconds with soap and warm water, just like you would with airborne pathogens. Hit it with some hand sanitizer, anything that you can do to try to nuke what was on the contact on your skin. And then if you do, use gloves, and you get bodily fluids on those, make sure you dispose of those and your sharps in an appropriate manner. Whenever you do a first aid class, they always do the thing with the gloves, where you put the gloves on and you put some soap or some shaving cream on them to simulate what it's like to have something slick on your glove as you try to take them off in a safe way. That's one thing, but also disposing of that properly in the appropriate manner is another thing. So make sure that you do that as well. And that rounds out the self care portion of our presentation. We have one more short module on risk management after this, and so please stay tuned for that.